worms. The adult worms live in the subcutaneous connective tissues of their victims, from where the females emerge to release thousands of larvae into the water, where they're taken up by intermediate hosts, which are tiny aquatic crustaceans called cyclops. In these hosts they mature into infectious larvae that infect humans when the crustaceans are accidentally swallowed in contaminated drinking water. On maturity, the large female worm, which can be nearly up to a metre in length, protrudes from the skin, usually of the leg, and causes intense inflammation and irritation. The effects of the disease are crippling. Its victims develop large ulcers, usually in the lower leg. The ulcers swell, sometimes to the size of a tennis ball, and burst, releasing the spaghetti-like parasitic worm. Victims experience a pain so excruciating that they say it feels as if their leg is on fire. The searing pain compels people to jump into the water, often the community's only source of drinking water, to relieve the pain. When the infected person immerses their leg in the water, the worm in the leg releases thousands of larvae. These larvae are ingested by cyclops, and the cycle begins again. The most common way to treat guinea worm disease involves wrapping the worm around a stick. This treatment has been employed for millennia and may have inspired the rod of Asclepius, which historically symbolized the medical profession. As the adult worm begins to emerge from the patient's skin, it's wound around a stick and then further extracted by a few centimeters each day. This slow process can take days or even weeks, but it's required to avoid breakage and leaving behind a portion of the worm. Leaving some of the dead worm to remain in the host body increases the risk of infection and can trigger immune responses resulting in pain and swelling. In many